Chapter 4 Human Health. In this chapter, we are going to learn what are the differences between infectious and non-infectious diseases, how do infectious diseases spread, how are the microorganisms that enter the body killed. Have you heard about the Zika virus? This virus is transmitted by Aedes aegypti and Aedes albopictus mosquito. What are the symptoms experienced by people infected with Zika virus? This virus usually causes fever, rash, muscle pain, joint pain, headache, and conjunctivitis. For infected pregnant women, the virus can cause serious birth defects in babies, where babies are born with underdeveloped heads and brain damage. A disease is an abnormal condition of body or mind that causes discomfort, difficulty to function, or stress to an individual. Diseases can be classified into two, namely infectious diseases and non-infectious diseases. What are the differences between these two types of diseases? Infectious diseases are normally caused by pathogens. Pathogens are microorganisms like bacteria, virus, fungus, and harmful protozoa. Parasitism, a type of symbiosis which occurs between a pathogen and a person who contracts an infectious disease caused by the pathogen, in which the pathogen is the parasite that obtains food from its host. The person who contracts the infectious disease is the host that is harmed. Example of disease that in infectious disease class, there are tuberculosis, flu, ringworm, tinea, leptospirosis, dengue fever, malaria fever, and Zika fever. A disease that can be transmitted from one individual to another. Non-infectious disease is caused by genetic factor or lifestyle. Example of diseases in this category are cancer, hypertension, diabetes, asthma, and cardiovascular diseases. This disease that cannot be transmitted from one individual to another. Do you know how are infectious diseases spread? Infectious diseases are spread by pathogens, the organisms that cause diseases. All viruses, some bacteria, protozoa, fungi, and worms are pathogens. Infectious diseases are spread to humans in many ways. There are waterborne, airborne, contact, or vectors. Infectious diseases are spread by pathogens transmitted from an infected person or host to another person through vectors and mediums such as water, air, and contact. The host is a victim who is weak and easily infected. After getting infected, the host will show certain symptoms of the disease. Airborne diseases. There are two ways airborne diseases are transmitted: through droplet transmission and dust transmission. For droplet transmission, pathogen that are containing droplet sprays from the mouth and nose of an infected person through sneezing, coughing, talking, yawning, or breathing. For dust transmission, bacteria in the spit or saliva of an infected person dry up and form spores which are spread together with the dust in the air. Not all microorganisms are pathogens that are harmful to health. There are some bacteria acting on food residue in the large intestine to produce vitamin K and vitamin B12, which are absorbed by the body. Airborne diseases can be prevented by practicing the following ways. Cover the mouth and nose when sneezing, coughing, or yawning. Do not spit everywhere. Avoid being in a crowded place. Ensure the living place gets enough light, as ultraviolet rays can kill certain microorganisms in the air. Examples of diseases that can be spread through air are tuberculosis, flu, severe, acute respiratory syndrome or SARS, influenza A or H1N1, chickenpox, and latest is COVID-19. Waterborne diseases. Infection through water usually happens in areas with inadequate water supply and poor sanitation. For instance, when someone uses a toilet built over a river, fecal pathogens enter the river and pollute the river. A person can be infected by pathogens when he drinks the contaminated water. Other than inadequate water supply and poor sanitation, floods can also spread infectious diseases. Among the diseases that are transmitted through water include cholera, typhoid, and amoebic dysentery. Infection of diseases through water can be prevented by the following ways. Add chlorine into swimming pools and water supply systems. Build toilets with good sanitation. Boil drinking water properly. Wash hands with soap after using the toilet. Infection of diseases through contact. Two examples of diseases that can be transmitted through contact are ringworm and tinea. Both are caused by fungi. Accidentally touching the infected skin or wearing the clothes of an infected person will cause infections to occur. Diseases like syphilis and gonorrhea can spread through sexual intercourse. Pathogens of these diseases are present in body fluids such as semen and vaginal fluid. The HIV virus that causes AIDS can also be transmitted through sexual intercourse, blood, as well as exposure to syringe sharing among patients and among drug addicts. So this is tinea, ringworm. Infection of diseases through vectors. Some pathogens are transmitted from one host to another new host through animals. Animals that transmit these pathogens are called vectors. So the table 4.1 shows some vectors and their pathogens. Cockroach carry Salmonella typhi. Fly carry Salmonella typhi. Aedes mosquito carry dengue virus. Aedes mosquito also carry Zika virus. Anopheles mosquito carry Plasmodium malariae. Rat carry Leptospira sp bacteria. Table 4.2 shows several types of diseases, symptoms, pathogens, vectors, and ways of infection. For malaria, the symptoms are shivering, fever, and sweating. For cholera, the symptoms are diarrhea and vomiting. For dengue, the symptoms are joint pain, fever, headache, and watery eyes. For Zika, symptoms are fevers, rashes, joint pain, and conjunctivitis. For typhoid, fever, intestinal bleeding, and red rashes. For leptospirosis, fever, headache, and muscle pain. How do vectors spread diseases? Mosquitoes and flies are the two vectors that spread numerous infectious diseases. Let us see how these vectors spread diseases. Mosquito. A mosquito that already has pathogens in its salivary glands sucks the blood of an uninfected person. Then the mosquito secretes saliva when sucking the blood to prevent blood clotting. The infection spreads throughout the body of the person. Another mosquito that bites the infected person transmits the disease to another victim. Fly. A fly that lands on dirt has pathogens on its legs and body. The fly transmits the pathogens to the food. The pathogens enter the body of the person who eats the contaminated food. The mechanism to prevent the spread of infectious diseases. How can infectious diseases be prevented from spreading? Prevention of infectious diseases involve three stages as shown in Table 4.3. Primary stage, by improving health, improving personal and family hygiene, cleanliness of living places, and sanitation systems. Strengthening the body's defense system. Getting vaccines and immunization for babies, children, pregnant women, food premises operators, Hajj pilgrims and travelers. Frequent health checkups, maintaining a healthy lifestyle, inhaling clean air, eating a balanced diet. Secondary stage, determining transmission of infections through active and passive case detection, giving early treatment to patients, separating patients from others. Tertiary stage, controlling vector populations, destroying vector breeding and hiding places, fogging to kill vectors, enforcing laws by issuing compounds to owner of dirty food premises, protecting hosts, using mosquito nets or mosquito coils, wearing thick clothes. Activity 4.1, to carry out a case study on diseases in Malaysia. You work in groups of 2 or 3, visit the website, gather information on the statistics of infectious diseases from the website, discuss the following matters. Okay, most common diseases in Malaysia, types of diseases transmitted, the causes and preventions, prediction of diseases progression based on the statistical graphs from Ministry of Health, suggestions to solve this problem. Present the outcomes using a multimedia presentation. You can use any type of multimedia presentation. Maybe you can use medium, video, audio, or PowerPoint. Submit your activity in Google Form that I will give you later. Now, you answer formative practice 4.1 in your exercise book 1. Submit in Google Form that I will provide later.